question okay?
Getting back. Question number 23. Which of the following is an example of a drug acting directly through the receptors? Okay, this is where we got stuck, right? Okay. Protamine. Okay, we have already gone through these options. Protamine binds stoichiometrically to heparin anticoagulants. Adrenergic beta blockers for thyroid hormone induced tachycardia. Epinephrine for increasing heart rate and blood pressure and cancer chemotherapeutic agents. Answer is epinephrine for increasing heart rate and blood pressure. So just now we have discussed all these remaining stoichiometric binding and cancer chemotherapy and induced tachycardia. Induced tachycardia, these are all slightly chronic and delayed effects. Okay, and but this one, effect on the heart rate and blood pressure, it should be an immediate effect. So, even whatever may be the drug, it may be a chronic or it may be immediate effect, should act on the receptor. But direct action and indirect action and acting through different mechanisms. So slightly you try to correlate where here. Okay, directly acting, it should be something which is related to direct immediate actions. Okay. So moving forward to the next question. Okay. Very important question. Very easy, very important. What does pharmacokinetics include? Options. We'll see the options. Complications of drug therapy, drug biotransformation in the organism, influence of drugs on metabolism processes and influence of drugs on genes. Okay. So what's the right answer? Pharmacokinetics, what does it include?
Biotransformation of drug.
Yes, biotransformation of drug in the organism. So as we all know, what does pharmacokinetics include? What does pharmacokinetics include? The study of ADME, that is absorption, distribution, metabolism and excretion. Not elimination. Don't call it elimination. I already told you what is elimination. Elimination is metabolism and excretion. Combinedly it is known as elimination. Okay. E is in ADME, E is excretion. Please remember this. Okay. So drug biotransformation. So what happens to a drug in the organism? What body does to the drug is nothing but pharmacokinetics. Okay. So ADME, what is the drug biotransformation it undergoes? Absorption, undergoes distribution, undergoes metabolism and undergoes excretion. This is known as the biotransformation of a drug in the body, that is known as pharmacokinetics. Very easy question and but very important question. Okay, question number 25. Which of the following actions is ascribed to the delta type of opioid receptors? Even this is a repeated question. Okay, from the previous test. Which of the following actions is ascribed to the delta type of receptors, opioid receptors? And the options are supraspinal analgesia, respiratory depression, euphoria and reduced intestinal mobility. Okay. So, how many types of, what's the right answer? The right answer is related to supraspinal analgesia. So, we all know various types of opioid receptors. How many types are there? How many types of opioid receptors? 4 types. We have discussed this earlier too. Mu, kappa, yes, delta and NOD. This is also known as nociceptine. I told in my previous discussions. I already mentioned in this in my previous discussions. NOD is also known as nociceptine. Okay. So mu, kappa, delta and NOD. So out of this, delta is responsible for supraspinal analgesia. That means through which type of receptors are these opioid drugs acting? opioid receptors and these drugs, this activity, what is it related to? So through which receptors do that particular drugs act to treat this particular ailment, or in a particular manner why is it acting on it? Okay, so when the drugs act through delta receptors, it acts as a supraspinal analgesic. And respiratory depression, when it is respiratory depression, it acts through mu receptors. Okay, respiratory depression is controlled by action of opioid drugs through the mu receptors. And euphoria, also mu receptors, reduced intestinal motility, kappa receptors. Okay, very important, all 4 types of opioid receptors. Moving on to the next question. Yes, therapeutic level of phenytoin is. Okay, this is something you need to remember. Okay, no analysis in this. It is not an analytical question. Therapeutic level of phenytoin is 0 to 9 mg per ml, 10 to 19 mg per ml, 20 to 29 mg per ml, and 30 to 39 mg per ml. And right answer is, it is 10 to 19 mg per ml. Okay. So slight assumptions you can make is phenytoin is a protein bound drug. Okay, phenytoin is a protein bound drug. So slightly it may not be so high. 30 to 39 mg per ml, it cannot be so high. The therapeutic level cannot be so high because it is a protein bound drug. Okay, so it can be something in between. It is 10 to 19 mg per ml. So it's something like an elimination. You can eliminate this, but you need to choose among these two. Okay. Okay, moving forward to the next question. Question number 27. Statement 1, anxiolytics are CNS depressants, and statement 2, antipsychotics are CNS depressants. Okay, based on the above statements, find the correct statements. So based on these 2 statements, they have given some other statements you need to analyze. Okay. You need to analyze. Okay. Okay. Option A, anxiolytics cause euphoria, antipsychotics cause euphoria. Antipsychotics are also called antidepressants, and anxiolytics cause apathy or dysphoria. Okay. So these are the various options given. Which is the right answer? Right option? Right option is anxiolytics cause euphoria. That is the correct statement. Anxiolytics are CNS depressants, and antipsychotics are also CNS depressants, but antipsychotics mechanism of action is completely different, and anxiolytics mechanism of action is completely different. Okay, so out of these what can we generalize is anxiolytics can cause euphoria. Okay, and next question, very important question. Action of parathormone in human body. Action of parathormone in the human body. So, and the options are decreases blood sodium level, increases blood sodium level, decreases blood calcium, and increases blood calcium. Okay, and what's the right answer? What's the right answer? Parathormone increases the blood calcium level. So remember, parathormone, something related to thyroid hormone. Parathormone is nothing but, it is also known as parathyroid hormone. Parathormone means, the other name for parathormone is parathyroid hormone. It is also known as parathyrin. Also known as parathyrin. What does it cause? When there is a decrease in calcium level, you know, when the blood calcium level decreases, it immediately influences our thyroid regulation. Iodine directly to thyroid, but it is calcium related to parathyroid. Okay, calcium is related to parathyroid and iodine is related to thyroid. Okay, and both are interrelated. Of course, they are interrelated. But when there is action of what does parathormone do? It increases the calcium level in the body. Question number 29. Which of the following statements is true? We'll see what are the statements first. Okay, and the statements are thyroid secretes more T3 than T4. Thyroid secretes more T4 than T3. T4 is a major circulating hormone and none of the above. What's the right answer? Right answer is thyroid secretes more. No, it is more T4 than T3. Okay, sorry, it was misprint. Okay, thyroid secretes more T4 than T3 is the right statement. Okay, so as we all know, T4 is tetraiodothyronine. T3 is triiodothyronine. Okay, tetraiodothyronine and triiodothyronine, which is the active form. Thyroid produces these two hormones T3 and T4. You are all clear. Okay, which is the active form, T3 or T4? Which one is more active? T3 is the more active form. But so if the question is which of the following, T3 is the more active form, then that should be the right option. T3 is the active form of thyroid hormones, but more secreted is this thyroid secretes more thyroid than T3. Okay, in the ratio of, even remember the ratio, it is in the ratio of 14:1. The ratio of secretion of T4 to T3 by thyroid hormone is 14 times than that of T3. Okay, so after secretion, what happens? This T4 gets converted to the active form T3 and then it goes for circulation and it elicits its activity. Okay, remember this ratio also. The ratio to T4 to T3 is 14:1 ratio. Okay, we are moving to the next question. Okay, one of the following drugs combat acromegaly by acting as a somatostatin analog, a growth hormone that releases inhibiting factor. Options are octreotide, pegvisomant, sodium iodide 131 and desmopressin. What's the right answer? Yes. And the right answer is octreotide. Octreotide is a somatostatin analog. You all know. Somatostatin is a growth hormone. Okay. So octreotide, it is a somatostatin analog which is responsible in treatment of combat. What do you mean by drugs combat acromegaly? Which is responsible in the treatment of acromegaly. Okay. And what is pegvisomant? How does pegvisomant act? Pegvisomant is also something which is related to this acromegaly, but it acts by antagonizing GH. It antagonizes GH. GH is growth hormone. It is a growth hormone antagonist, pegvisomant. Okay. And sodium iodide 131 is used in the treatment of hyperthyroidism. Yes, very good. Hyperthyroidism. And desmopressin, it is used in, it is a anti-diabetic, the anti-diuretic hormone. It is used in the treatment of cranial diabetes. It is used in the treatment of cranial diabetes. Okay, is it clear? So for this, the right answer is octreotide. Okay, next question. Choose the drug which is a H2 receptor antagonist. Direct question. And the options are omeprazole, pyrazine, carbenoxolone and ranitidine. What's the right answer? Ranitidine is the right answer. Yes, very good. Omeprazole is a proton pump inhibitor. Pyrazine is, all these are, what kind of drugs are all these? Anti-ulcer agents. Omeprazole, pyrazine, carbenoxolone and ranitidine, all these are anti-ulcer agents. And omeprazole is a PPI, proton pump inhibitor. Pyrazine is a, I told you in the earlier classes also, what is it? Muscarinic, M1 antagonist. It is a M1 antagonist. And carbenoxolone, it is a ulcer protector. It protects the mucosal barrier protector. It is a protector of mucosal barrier. And ranitidine is a H2 antagonist, H receptor antagonist. Okay. I am repeating so many times. Remembering these mechanisms of action is very important. Whatever you are preparing in pharmacology, you are clear. You are thorough with these mechanisms of action and categories and certain important adverse and side effects. You can easily clear 10 to 12 questions from pharmacology. I am repeating from day one this one. Okay. Please make a note of this point. Okay. And one more assertion, reasoning. Question number 32 is determine the correctness or otherwise of the following assertion and reason. Okay. And the assertion is sucralfate should not be administered with antacids. Reason: antacid decreases gastric pH and makes sucralfate ineffective by inhibiting its polymerization. So we'll see the options. A and R are true, reason is correct explanation. A and R are true, reason is not correct explanation. A is true, R is false. Both A and R are false. What is the right answer? What's the right answer? What is sucralfate, by the way? It is an ulcer protective. Sucralfate, similar to carbenoxolone, it is a ulcer protective agent. So what's the mechanism? So it should not be administered along with antacids. What's the right explanation for this? Right answer is A is true and R is false. Okay. Sucralfate should not be administered with antacids is true. It should not be administered with antacids. But antacid decrease gastric pH and makes it ineffective by inhibiting its polymerization. That is wrong. Okay. Sucralfate should not be administered with antacids because these antacids, they reduce the efficacy of sucralfate. Okay, they prevent the binding of sucralfate to ulcers. It is an ulcer protective agent, sucralfate. So what should it do? It should bind to the ulcers to make a protective barrier. So these antacids, they prevent the binding of the sucralfate to that particular ulcers. That is the reason why it should not be administered along with antacids and nothing to do with its polymerization or something. Clear? Okay, moving forward to the next question. The drug Sorelia. So this completes pharmacological part of the question paper. Moving forward to pharmacognosy part. Okay. Question number 33. The drug Sorelia, when dissolved in alcohol and little sodium hydroxide, shows. Okay, chemical test of Sorelia. What's the right answer? Yellow fluorescence, blue fluorescence, green fluorescence and pink fluorescence. What the right answer is? Right answer is yellow fluorescence. Okay, when Sorelia is dissolved in alcohol and sodium hydroxide, it gives yellow fluorescence. Okay, so same drug Sorelia, when it is dissolved in alcohol along with propylene glycol, PG is propylene glycol and acetic acid along with water, it gives a blue fluorescence. Sorelia ante only yellow fluorescence and fix ayipodu. There are some other tests also. So when it is dissolved in alcohol and sodium hydroxide, it gives yellow fluorescence. When it is dissolved in alcohol and along with propylene glycol and acetic acid, it gives blue fluorescence. Okay, so try to differentiate when such questions occur. These type of questions do occur frequently in Gpat and these competitive examinations. They occur frequently. So you need to be thorough with those chemical tests and their colors, especially colors and fluorescence. Okay. So when it is with sodium hydroxide on, like when we keep it aside, it gives slight yellow color, right? So remember, sodium hydroxide will give yellow fluorescence. For Sorelia, when you are keeping sodium hydroxide slightly aside for certain time, it changes to slight yellow color we get, right? So that you can correlate to yellow fluorescence here. Okay. So it's a lengthy question, but the answer is very simple, I feel. Okay. One of the important items of export covering approximately 80%. No, you definitely do get these types of questions in your competitive and especially this national level examinations, Gpat or so. The question may be simple, but slightly they try to confuse you slightly. You don't need to get confused. Only identify, absorb what is necessary for you and leave the remaining. One of the important items of export covering approximately 80% of world requirement is a proteolytic enzyme papain, which is mainly manufactured in. Okay, so what's the question here? Papain is the proteolytic enzyme. Papain is mainly manufactured in. Okay, middle question anta, that is trash. But some trash will be included. You need to identify which one is right. Okay, and the options are Andhra Pradesh, Maharashtra, Arunachal Pradesh and Haryana. What is the right answer? Right answer is Maharashtra. Okay, some geographical. So you need, like we were discussing in pharmacognosy, you need to be true about the biological and geographical sources and chemical constants, right? So this is a question, something which is related to the geographical and biological source of this papain. Papain is obtained from papain. Papain is obtained from Papaver somniferum called Carica papaya, right? That's what. Don't be. Yes, Papaver somniferum. It gives opium. Okay, that is completely a different section. Papain is obtained from Carica papaya. So don't get confused. Even this is confusion between the names. Don't get confused with those names. Completely different section. Okay. The cardiac glycosides on hydrolysis. Cardiac glycosides of glucosylaren on hydrolysis gives. So options are glucose, rhamnose and silaranine, procylleridine plus glucose plus fructose plus rhamnose plus procylleridine and none. What's the right answer? And the right answer is glucose, rhamnose and silaranine. Okay. So what is the biological source of glucosylaren? What's the biological source? What's the common name of the biological source from which this glucosylaren is obtained? Amma, silaren. When you see this silaren, it is obtained from squill. It is obtained from squill. Just identify that. That's what I'm repeating so many times. Identify the biological sources properly. Okay. Very important question. Question number 36. Monkey skin aloe is also called as. Monkey skin aloe is also called as Cape aloe, Socotrine aloe, Zanzibar aloe and Curacao aloe. What the right answer is? Zanzibar aloes. Okay. What is Cape aloe called? Monkey skin aloe is called Zanzibar aloe. What is Cape aloe called? Cape aloe also called as aloe ferox. It is also known as aloe ferox. Socotrine aloe? Aloe berry. Yes. Very good. Socotrine aloe is also known as aloe berry. Curacao aloe is known as aloe vera. Aloe vera. Okay. So Zanzibar aloe, monkey skin aloe, Cape aloe, aloe ferox, Socotrine is aloe berry and Curacao aloe is aloe vera. Different types of, just different manufacturing or different brands of aloe. Okay. Please remember all these names are very, very important. Students. Cascara contains. Question number 37. Cascara contains. So what does it contain? O glycosides, C glycosides, S glycosides and both O and C glycosides. What is the right answer? Right answer is both O and C glycosides. This is a direct question. Yes. And the glycosides of cascara are known as cascarosides. The glycosides of cascara are also known as Cascarosides, they contain both O and C glycosides. Question number 38. In quantitative TLC, the radioactive material can be studied by. Okay. So, what are the various detectors or methods by which, in quantitative TLC, by which method the radioactive material can be studied? The options are visual comparison, densiometer, gravimetry, and Geiger-Müller counters. What's the right answer? The right answer is Geiger-Müller counters. This is a direct question. So, when there is a estimation or analysis of a radioactive material, we know only some of the detectors are used, detectors or material or whatever, lights or lamps, whatever they are used. Okay, that is known as Geiger-Müller counter. So you know Geiger-Müller counter is related to radioactive substances. So you leave whether it is TLC or something. You correlate Geiger-Müller to this radioactive material. Okay. Question number 39. If tannins are hydrolyzed by mineral acid or enzymes such as tannins, they are called as. Very simple question, very easy question, right? They are known as condensed tannins, non-hydrolyzable tannins, hydrolyzable tannins, and phlorophenes. What's the right answer? Hydrolyzable tannins. Okay. So whenever we come across these such type of questions, we get into some confusion, right? No, why such direct questions are given? ఇలా డైరెక్ట్ క్వశ్చన్ ఇచ్చారు అంటే దీంట్లో ఏదో ఉంది అని అనుకుంటాం కదా. ప్రతిసారి అలా అనుకోవాల్సిన అవసరం లేదు. కొన్నిసార్లు ఏదో ఉంటుంది, బట్ సమ్ టైమ్ నాట్ ఆల్వేస్ ఇట్ ఈస్ నాట్ పాసిబుల్ దట్ సంథింగ్ షుడ్ బి దేర్ ఇన్ దట్. Just understand the question, read the question twice. If you see the question is direct, then answer it directly. That's it. Don't go for so many types of estimations. You estimate and analyze only when it is necessary. Don't waste your time on unnecessary analysis. Okay? Question number 40. Which ergot alkaloid is water soluble? Which ergot alkaloid is water soluble? The options are ergotamine, ergocene, ergocristine, and ergometrine. What's the right answer? Ergometrine. Okay, ergometrine is water soluble. Compared to ergotamine, ergocene, ergocristine, all these are insoluble in water, and ergometrine is soluble in water. Okay. Okay. Biological source of Nux vomica is. Even this is a very direct question and an easy question. Biological source of Nux vomica: Strychnus nux vomica, Strychnus potatorum, Strychnus nux blanda, and Strychnus wallichiana. What is the right answer? Strychnus nux vomica. This is the right direct question. Okay, very important. Again, one of the important questions from chemical constituents. Lemongrass oil is obtained from. Lemongrass oil is obtained from Cymbopogon flexosus, Cinnamomum camphora, Eucalyptus globules, and Chelopodium ambrosiates. What's the right answer? Right answer is Cymbopogon flexosus. Okay, lemongrass oil is obtained from Cymbopogon flexosus. What do we obtain from Cinnamomum camphora? Cinnamomum camphora. Please don't say that. We obtain camphor oil. Camphor oil or camphor element, right? Cinnamomum camphora, that gives camphor oil. Eucalyptus globulus, eucalyptus oil. Because we are studying lemongrass oil, I am telling you all this. What are the remaining constituents? Important constituents of remaining options. Chelopodium ambrosiates, Mexican tea. Mexican tea. Okay, these are the important constituents of these various biological sources. Okay, question number 43. When transverse section of clove is treated with potassium hydroxide solution, it gives Again related to chemical tests. This question is related to the chemical tests. What does it give? It gives a strong odor of volatile oil. Hydrogen sulfide gas is evolved. Carbon dioxide is evolved, or needle-shaped crystals of potassium eugenate is formed. What is the right option? Option is needle-shaped crystals of potassium eugenate. It gives, okay? Club gives. When a transverse section of club is treated with potassium hydroxide solution, it gives a needle-shaped crystals of potassium eugenate. Okay, question number 44. Which of the following is true about cinnamon? Okay. The statements are: P, it contains compound quill. Q, it contains prismatic calcium oxalate crystals and U-shaped stone cells. R, cork is absent but contains cortex. And S, it contains eugenol. So, we'll see what are the options. P true, Q true, R false, S false. P true, Q false, R false and S true. P is true, Q is false, R is true and S is false. P, Q are true and R is false and S is true. Which one is the right option of this? No clue, right? And the right option is option B. P true, Q is false and R is false and S is true. Okay. P and S are true, but Q and R are false. Okay. So it contains, cinnamon contains compound quill and it contains eugenol. Okay. And it does not contain calcium oxalate crystals, and cork is absent, cortex is present is also wrong. Okay. It contains both cork and cortex. Cinnamon. Okay. Number 45. Anethole is a chemical constituent found in. Very important question. Anethole is the chemical constituent found in Anethum graveolens, Fructus feniculum, Eucalyptus globulus and Eugenia caryophyllus. What's the right answer? Anethole is chemical constituent found in. What we usually feel? Because anethole is similar to Anethum graveolens, we feel Anethum graveolens is the right answer, right? But that is not the right answer. The right answer is Fructus feniculum. Okay. Fructus feniculum, also known as Feniculum vulgare. Fructus feniculum is also known as Feniculum vulgare. What is the common name of Feniculum vulgare? Fennel. Simple. It is nothing but fennel. Fennel means swamps. Okay, what we usually use, swamps. This fennel. Feniculum, it is, anethole is the chemical constituent which is present in Feniculum vulgare rather than Anethum graveolens. Okay. Which of the following drug is an antibiotic compound of marine drugs except? Okay. So, many times we usually focus, okay, which of the following drug is an antibiotic compound of marine drugs, and we exclude or we accept that, except don't accept that, except is very important. Okay. In regular conditions, except is exceptional. No, that is exceptional, but in competitive examinations, except is very important. Okay, and options are cycloeudesmal, ethylene 1, laminin and variabilin. What's the right answer? And the right answer is variabilin. Okay, all these are. Okay, this is a variabilin, it is a glycoprotein antagonist. It is not an antibiotic. All the remaining are antibiotics which are obtained from marine. All these four, cycloeudesmal, ethylene, laminin, variabilin, all are obtained from marine drugs only. Okay, all these are chemical constituents of marine drugs, but this variabilin is not an antibiotic. It is a glycoprotein antagonist. It inhibits variabilin. Whenever you come across variabilin, you remember it is a glycoprotein aggregation of platelets. Okay. Again, biological source of halitoxin. Biological source of halitoxin is, so this halitoxin is obtained from some sponge. Everything are sponges actually here. Okay, sponge Yersinia strobylina, sponge Philospongia dendi, red algae Digenea simplex, and sponge Haliclona viridis. What's the right answer? Sponge Haliclona viridis. Okay, because it is something related to halitoxin and Haliclona viridis. Okay, don't use the same technique for everything. In the just now we have discussed about anethole. These things if you are not very sure, because these are all marine drugs, and if you are not very sure, then you go for correlation or elimination. Either you have to go for correlation or you have to go for elimination. If you are not sure, if you are sure, go with your surety. But if you are not sure, go either with correlation or elimination. Here you can go for slight correlation, because halitoxin, it is something Haliclona, the names are similar. Then take a chance. Sponge Haliclona viridis. Okay. And so this completes pharmacognosy part, and question 48 is from pharmaceutics. Binding of drugs with plasma albumin is. Okay, options, we'll see the options. What are they asking about the plasma protein binding of drugs? It is reversible and non-specific, reversible and specific, irreversible, and non-specific. What's the right answer?
Reversible, non-specific.
Reversible and non-specific, because most of the drugs binding drugs with plasma albumin is reversible. It is reversible and it is non-specific. Okay, it is not like plasma albumin is the largest protein which binds many drugs which enter the systemic circulation. So it can't be specific because it is abundantly present. So because it, and not, what does non-specific indicate here? Many different types. Like it may be an acidic drug, it may be a basic drug, it may be a amphoteric drug, any kind of drugs. Here non-specificity means it binds any kind of drugs. But coming to, so what are the other plasma proteins? Alpha acid glycoprotein. Okay, AAG. Coming to AAG, alpha acid glycoprotein, it binds. Alpha acid glycoprotein, it binds only basic drugs. This is the alpha, remember alpha acid glycoprotein, it binds only basic drugs. Mostly it binds basic drugs. Okay, albumin also mostly binds acidic drugs, but it is slightly non-specific. It is not that specific. Okay, but AAG, it is specific. It binds only basic drugs. You remember this. So, and the answer is binding of drugs with plasma albumin is reversible and non-specific. Okay, coming to the next question. 49, very important question, very important question, very easy question also. Just slightly you identify the question and the answer. Biotransformation of the drugs is to render them less ionized, more pharmacologically active, more lipid soluble, and less lipid soluble. What's the right answer? Biotransformation. After biotransformation, what happens to the drug? What it causes? Less lipid soluble. Biotransformation renders a drug less lipid soluble. It makes the drug more hydrophilic. Okay. So we usually discuss, for absorption to happen, the drug need to be, for a drug to be easily absorbed, it needs to be more lipophilic. For a drug to be highly absorbed, it needs to be more lipophilic. For a drug to be easily excreted, it needs to be more hydrophilic. For excretion, more hydrophilicity is needed. So, biotransformation, it causes the decrease in the lipid solubility and decrease in the lipophilicity of the drug, so that the drug is not reabsorbed. It should be after its complete action. Okay, after the drug is absorbed, distributed, and it elicits its action, then it undergoes metabolism. So after metabolism, the metabolites need not be absorbed. It should not be absorbed again. So the drug should be hydrophilic. The hydrophilic drugs are not reabsorbed. To prevent reabsorption, the drug biotransformation causes decrease in the lipid solubility of the drugs. All the other options also we can see. Does it make it less ionized? No, it makes more ionized. More pharmacologically active? No, less pharmacological. After metabolism, the drug is less pharmacologically active or not active at all actually. More lipid soluble? No, it is less lipid soluble. Yes, and the next question. The following drug undergoes non-linear pharmacokinetics. Okay. And the options are phenytoin, digoxin, amphetamine and propranolol. What's the right answer? Right answer is phenytoin. Okay, what do you mean by non-linear kinetics? Non-linear kinetics is mixed order kinetics or saturated kinetics. Okay, saturated kinetics, mixed order kinetics. So, phenytoin just now we have discussed, it undergoes protein binding, and so the main in non-linear, what is the major factor for phenytoin which causes its non-linearity? Absorption or distribution or metabolism or excretion. Where is the limitation? Is capacity limited kinetics, right? Non-linear kinetics is capacity limited kinetics. So what is the factor out of ADME? What is the limitation for phenytoin which causes its non-linearity? No, rather than distribution, metabolism. Okay, the saturated metabolism for phenytoin, there is a saturated metabolism which causes non-linearity. Okay, this is saturated metabolism is responsible for the non-linear pharmacokinetic action of this phenytoin. Okay, clear? Okay, we are closing this session now, and this further session will be continued and you will be notified at the earliest regarding the further discussion. So we regret the inconvenience. Thank you.